Welcome back. Our focus is a nightmare, but also a dreaded reality. And this time, the victim is a doctor himself, working at a top-notch hospital in India. He lost his father recently in Kerala. Taking to social media, Dr. Ashwin Vinod has claimed his father was rushed to TMH Hospital in Kerala's Kozhikode after complaining of chest pain and breathlessness. This was the hospital nearest to their residence in Kozhikode. The father couldn't be saved, but the son, Dr. Ashwin Vinod, has claimed that the resident medical officer who treated his father at TMH Hospital had not even cleared his MBBS examinations, that he had enrolled in 2011 and still did not manage to clear his second professional exams, enrolled as an MBBS student for 13 years without any progress. Questions are also being raised at the background check done or not done in this case by the hospital. The TMH Hospital, speaking to Mirror Now, has said the concerned doctor practiced in several hospitals and the doctor had his private practice as well. We got to know about the RMO's quote-unquote ineligibility after the incident occurred. We verified the RMO's registration number given to us. The RMO claims only one back paper was remaining. The concerned RMO, that's a resident medical officer, has been suspended. Extremely worrying, because these are also not one-off cases. Courts after courts have ruled on this massive challenge, fraud to say the least, from Tamil Nadu to Telangana to Bihar, even in Kerala. There have been several botched up surgeries, life lost as lifesavers botch up the battle between money and ethics. I've been joined at this point by Dr. Ashwini P. Vinod, who in this case is a doctor but also the victim's son, as well as Dr. Rajeev Jayadevan. Thank you very much, both of you, for joining us. Do we have Dr. Ashwin P. Vinod? Yes. Good evening, sir. Thank you so much for joining us. You'll have to unmute yourself. Firstly, heartfelt condolences to for what's happened to the family, for what's happened to your father. But there are huge allegations that you're making, and I must tell our viewers again that you yourself are a practicing doctor at one of the reputed hospitals in India. But what happened, Dr. Ashwin P. Vinod? What are your big concerns at this point? You'll have to unmute yourself, Dr. Ashwin. We can't hear you. Dr. Ashwin, if you can unmute yourself, or if there's a technical issue that can be fixed. Okay, we'll try and sort this out. Of course, Dr. Ashwin is the son, is a practicing doctor, and his version is hugely important, but he has taken to social media. If we can get on Dr. Rajeev Jayadevan at this point. Dr. Rajeev Jayadevan, it was important to get you as a response to what Dr. Ashwin was saying, but let me start off with you. Allow me to interrupt you whenever we get Dr. Ashwin first, because he seems to be in an area where signals are a challenge. But Dr. Rajeev Jayadevan, from what Dr. Ashwin is saying, he is a practicing doctor in one of the most established hospitals in India, and he's saying when he went for the cremation of his father, which itself is heart-wrenching, it's extremely difficult for any son or daughter to go through, what he realized, the hospital where his father was treated, which was nearest to his house, had a fake RMO in the sense that he hadn't even finished his MBBS. So, firstly, an apology or a statement of regret from the hospital saying we did not know, we got to know about this after the incident and we have taken correctional steps as the hospital has claimed. Is that acceptable? And if we can have the hospital statement up on the screens, please.
First up, Dr. Condolences to Dr. Ashwin. It's heartbreaking to lose one's father, and my condolences. It's as Sneha said, it's even more heartbreaking to know that as a doctor, the person who last took care of your own father did not have a medical degree, and that can be inconsolable, regardless of what the hospital says. So Dr. Ashwin deserves to be thanked for bringing up this important issue as India goes forward with all the progress that we have made. Recently, we heard about fake medicines from CDSCO's recent bulletin. Now we're hearing about fake doctors. So things have to be tightened in our country. Even in a state like Kerala that boasts of relatively good healthcare systems with a doctor population ratio, which is well above what is recommended by the World Health Organization. Kerala has one doctor for every 500 people in the population, as we last checked, which is well above the national average. So even in such a state, it is devastating to know that a person who is in charge of the sickest people, in casualty, that's where the sickest people come in. And if a person who's not qualified, not even qualified with an MBBS degree, is seeing these patients, that is deeply concerning. The Indian Medical Association is also deeply concerned, and we've repeatedly said from the association to hospitals to please verify the new recruit doctors' credentials, and also to display the registration numbers on the doctor's notice board. Where they post the doctors' names, every hospital will list the doctors on a bulletin board. They must not only display the doctors' names and degrees, but also the registration numbers. Why? Because the patients and the relatives can verify using the registration number if the doctor is a real doctor or not. We know that India has a very large number of doctors, both trained in the country and elsewhere. And it is also...
No, but Dr. Rajeev, if I can ask you, in this particular case, there was a registration number. The TMH Hospital has said there was a registration number. The registration number was given to the hospital. So, from what appears, he did have a registration number.
Yeah.
So that shows multilateral collapse of a system that's failed.
Right. So a registration number cannot be given without the person passing an MBBS degree. So that must be fake to start with. So at least the doctors, so people can verify that it is real or fake by simply having the registration number. Using the name, it can be difficult. Using an RTI, any citizen will be able to verify this with the respective medical council. I've trained abroad, and in the US, for instance, when you apply for a state license, they will verify directly with your medical school in India to make sure that the certificates you presented are legit or not. And only then will they even consider your application for a license. So the same procedure can be followed by each hospital, especially by the HR department when they recruit new doctors. The established doctors have been there for a long time, but especially when they recruit newer people, this must be taken very seriously indeed. And recently there was another case in the news about a doctor apparently operating on a YouTube video and a child dying as a
result.
I don't know
that was in Bihar, in Saran.
This happened in Bihar. And a few years ago, an important case came up in Kerala in the government sector where a doctor performed a cesarean section on a woman, and that doctor did not have
if you can have graphics of such earlier cases as well, please, on the screen.